Hello, everyone. Commonly used for stress, Ashwagandha is an ancient medicinal herb. It is one of the most important herbs in Ayurveda. Presenting Ashwagandha session today, we have Dr. Pooja Kiran, an Ayurveda doctor educated in UK and India. Dr. Pooja has over 15 years of experience working as an Ayurveda practitioner. She is joining live now from Boston. Welcome, Dr. Pooja.
Thank you, Amita, and thank you everyone for joining this session and people who are interested to know about Ashwagandha.
So this is a Q&A session, so I'm going to just get started. So what exactly is Ashwagandha and what does it contain?
Sure. Ashwagandha is an important herb in Ayurveda and is used widely as single herb or in combination with other herbs. And it's been used for thousands of years in Ayurveda. As a botanical name, it is known as Withania somnifera. So sometimes the herb is marketed or marketed as Withania somnifera or Withania. Ashwagandha is its Sanskrit name, and it belongs to the nightshade family. The eggplant belongs to the nightshade family, so it belongs to that family, and it has high medicinal value. It is classified as a rasayana in Ayurveda. Rasayana means a plant product or herbal product which helps in rejuvenation of the body, and it promotes physical and mental health and increases longevity. Ashwagandha's roots, seeds, and leaves are used in various Ayurvedic formulations. Now, as per Ayurvedic pharmacopoeia, ashwagandha possesses sweet, bitter, astringent taste. So when you take ashwagandha in a powder form, you will feel a very strong, bitter, astringent taste. And it has a sweet aftertaste digestion. Its qualities are, it's usually light in nature and unctuous in nature, and is hot in potency. So now you can see in this description, we can see how this herb has opposing qualities. So it has qualities that mitigate the three doshas as well as stimulate them. And that is why it is extensively studied under the classification of adaptogens, which is also one of its main property. So just to give you a glimpse of what adaptogen means and how ashwagandha works. Adaptogen is a class of plant compounds that have a unique ability to adapt their functions according to the specific needs of the body. It could be physical, it could be chemical and biological in nature. And their effect can be compared to the functioning of a thermostat. As the temperature keeps fluctuating, the thermostat, tries to control it and bring it to an equilibrium. And that's exactly what ashwagandha does. They have special compounds. Ashwagandha possesses opposing qualities, such as being relaxing and being stimulating. So they are opposing qualities, but it happens, the herb tries to manage it as per the needs of the body. Correct response is triggered according to the body's needs. Thus, when using ashwagandha, it should be used as part of a whole body treatment. And that includes proper diet, regular exercise, and adequate sleep. And that's the best way to get its complete benefit.
All right. So ashwagandha has been used for reducing stress and anxiety. At least that's what the research says. So
yes.
How does it work to help with the stress and anxiety?
Sure. As an adaptogen, as its property of an adaptogen, it has the quality to increase the body's ability to resist the damaging effects of stress and promote or restore normal physiological functioning. A lot of research has been done on lab rats to identify its anti-anxiety effects. It acts in non-specific ways to increase resistance to stress without disturbing the normal biological functions. And if you want to understand it, how it works in the body, it interacts with a part of the brain which is called the hypothalamus pituitary adrenal axis. So adrenal glands is one of the glands that is located on top of the kidney, and its main function is to release cortisol, which is a hormone, which is a stress hormone. So when a person is in stress, and the stressors could be anything. It could be pollution, it could be loud noise, it could be not a restful sleep, or it could be problems at your job or home front. So whenever a person is in any kind of stress, adrenal glands release a certain stress hormone called cortisol. So what happens is ashwagandha works on this adrenal pituitary adrenal axis and tweak the physiological responses to ensure optimal functioning of the body based on what the need of the body is at that time. So it has a relaxing effect on the adrenal glands, which decreases the adrenal cortisol level in blood, and it increases the serotonin level in the brain tissue, and thereby it reduces stress-induced anxiety. So it works on two hormones, cortisol and serotonin. Cortisol is stress hormone, and serotonin is the one that relaxes the the brain. So it works both ways, and that's why it's very helpful in stress-induced anxiety.
Great, great. So the following question is that from one of our viewers is that, can you take it every day? If yes, how much?
Yes, so it's safe to take it daily. There is no contraindication that it should be taken for, let's say, 1 week or 2 weeks. You can safely take it every day, and how much to is it depends. Like the benefits of ashwagandha take time to accumulate. First of all, I mean, you cannot take it for 1 week and then stop, because it needs time to accumulate its benefits, and that's why they need to be taken over a period of time. In clinical practice, we recommend taking ashwagandha for at least 3 months continuously to reap benefits.
Okay, so there are some powder forms or capsules. Is there any difference? One should take either powder or capsules?
Actually, ashwagandha has a strong bitter astringent taste, like I mentioned before. So it makes it really difficult for many people to take it in a powder form. In such cases, we can use capsule form. So capsules are basically the powdered form, but in capsule packaging. So it's easy to swallow. Some people find capsule forms difficult to swallow. So in that case, they can have liquid forms of ashwagandha. There are liquid forms of ashwagandha in combination with other herbs, such as ashwagandha rishtam. And then there are jam formulations, such as ashwagandha dileham. The jam form is good for children, old people, and those who have palatability issues. Then there is ashwagandha di grita, which is in ghee form. So there are different forms of ashwagandha, and the most common ones are obviously powder form or capsule form, which is easily available. Taking them in either form is absolutely fine, as long as the person is comfortable taking that. The only thing is powder form, you will have that raw taste. So when you take it in
with water, you have to mix it with water, the powder form? Okay.
It depends from condition to condition. For example, in conditions where, in infertility issues or emaciation issues where you want to gain weight, it's usually taken mixed with milk. But if it is for inflammatory responses, like you have arthritis or rheumatism or pain or swelling, then you can take it with water. Depending on what kind of condition you are suffering from, you can take it with that adjuvant. Milk, water, honey, ghee, they are all adjuvants. So if you're taking it in general form and you don't mind having capsules, you can just take 1 to 2 capsules twice in a day with water. That is fine. And if you want it specifically for problems where pitta is increased, and or you even for stress and anxiety, I recommend that if you drink it with milk, that has very good effect. And milk and ghee is very good for stress, anxiety, insomnia kind of conditions. You can have it before bedtime.
Okay. So I think for this particular one, healthy individuals who have minor anxiety issues, I think all of us fall into that category for that matter. So all of us are going through stress and anxiety nowadays, especially.
Right.
So it's safe to take it as you're suggesting, like 1 capsule a day for at least it takes continuously for 3 months or something like that.
Yes. There are certain conditions where you should be cautious while taking. Example, hyperthyroidism, because ashwagandha has properties that stimulates thyroid hormones. So if somebody has hyperthyroidism, the person already has more thyroid hormones in the blood, and taking ashwagandha would actually stimulate the thyroid to produce even more hormones. So people suffering from hypothyroidism should not take ashwagandha. In the same way, people who are pregnant, women who are pregnant, it's advised not to take ashwagandha during pregnancy. People who are on anticonvulsant medicines, even they should not take ashwagandha, because ashwagandha already has anticonvulsant stimulating property. So when you're on a drug which is already stimulating it, then you need not take another drug which would actually increase that activity. The same way, people who take insulin should not take ashwagandha as well, because ashwagandha has hypoglycemic activity. So when you take insulin, you already bring the hypoglycemic activity in blood. So you go your blood sugar lowers down, and taking ashwagandha, it could lower it down further, leading to extreme hypoglycemia. So you should not take ashwagandha while taking insulin.
Okay. So any side effects? I think you already mentioning about all
Yes.
these side effects
Yes.
that people with certain conditions, like if you're pregnant or if you have diabetes, taking insulin, you should avoid ashwagandha. Any safety issues or anything else, or would it fall into the same category which you just explained, and that we should?
There are no safety issues. Generally, it is a safe drug to take for healthy people as well. So there are no specific contraindications except for these certain conditions that I mentioned. People can, for healthy people, can definitely take it as a regular, dosage in their daily diet. You can have it before bedtime, which is the best time to take ashwagandha, because it relaxes the mind, so you get good sleep, and it reduces the anxiety levels, general anxiety. I mean, you don't have to suffer from anxiety issues, but generally the everyday stress can cause problems as well. People can get restless at night and have issues with sleep. They can take it, and it will definitely have better result when you take it over a period of time.
Great. This has been a very great session. These are small session Q&A sessions that we are trying to do, where we introduce a herb and doctor would answer the questions. So I want to thank Dr. Pooja for coming to answering our questions today. If you have any questions, the viewers who are watching us or watch later, please let us know your feedback. We have our emails written on this slide, and we have our WhatsApp number as well as contact information to contact Dr. Pooja Kiran. Thank you so much, Dr. Pooja Kiran, for coming. Any final comments from you before we wrap up?
Well, thank you very much, Amita, for giving me this opportunity to talk about ashwagandha. And if anybody has any questions, I'm open to answer their questions. You are open to post your questions at Nourish Doc, and we would be happy to help you. Thank you.
Well, thank you so much. Have the rest of the great afternoon, Sunday afternoon. Signing off now. This is Amita and Dr. Pooja Kiran. Thank you.
Thank you very much.